We're here with Dr. Robert Bean from Utah Health Quest, talking a little bit about chiropractic medicine and how it can make life a little bit more comfortable, or maybe a lot more comfortable.
Yeah, absolutely.
Talk about your passion and why you became a chiropractor and how it's really helped people.
Right. So I've always been intrigued by why does the body heal? You know, how does it do that? Especially when you're young, you get a cut on your hand and you know, within a few days it's gone. It's like, how does that happen? And that intrigued me from the very beginning. And so that just led me down that path.
You probably asked your parents a lot of questions.
Oh yeah.
You were a pugnacious kid.
And they asked me a lot of questions, especially when they saw I was, you know, going through college, everything's pre-med, and they're like, go honey, go, you know, pre-med, go to medical school, awesome. But I was just drawn a different path. You know, and so fortunately they weren't against me. They did support me. They did. So when I was young and going to different medical offices in the pre-med sciences, I would go and talk to doctors because I wanted to know, like, what's it like to be a physician? Do you like your job? And to be honest, I didn't get a lot of warm fuzzies.
Really?
I didn't get a lot of encouragement or like, yeah, go for it. This is great. I got a little bit more, you know, you should really think about it. I don't know. You just really need to think about it. Well, when you hear that or you get those impressions, it makes you step back just a little bit. And so I went to a lot of different of the medical sciences. I talked to physical therapists and chiropractors and acupuncturists, and because I just simply wanted to know where did I want to go? Where did I see myself? And I really got the most feedback from the different chiropractors that I visited. And they welcomed me in. They said, come on in, come watch me work, come watch what I do. And I was blown away with what they do all day, where they can sit down with a patient and within a few minutes they can feel or palpate the spine or the other parts of the body, and with their bare hands do something for that patient where they come out feeling better and doing better and appreciative and happy, and you know that they didn't have to go get a prescription or they didn't have to get injections or shots or something like that. They simply got some hands-on treatment that did something to them to make them happy and doing great and happy with their treatment. That was just very unique because that's, you know, your two hands you can take wherever you want. You're not bound by labs or equipment necessarily.
And you don't have to use those special words. This won't hurt a lot.
Right. Yeah, you won't feel a thing.
Yeah, exactly. This won't hurt me at all. It might hurt quite a bit.
Right.
So what I found when you get a relationship with a great chiropractor, you look forward to those visits because you know you're going to come out feeling better.
Yes.
And that's ultimately all we want.
Right. That's a golden relationship. You know, when you can have a one-on-one with a doctor who will listen to you and won't sit you down across from a desk and say, okay, you can ask me 2 questions. You know, that's what I hear from some patients is that, okay, you get to ask me 2 questions and that's it. And I'm baffled that that's what some of organized medicine has gone to, that, you know, you're my burden, you get to ask me 2 questions, I'm going to write you a script and out you go.
Ironically, my medical provider, when I lived in Las Vegas, I had 9 minutes with my primary care physician. That is the maximum they could be in that room with me.
Right.
And this is my doctor.
Right.
9 minutes.
Not the doctor's choice. Right?
No, not at all.
So I don't want to discourage people from seeking medical care. Doctors are good-hearted people who went into it for the right reasons, but in that same office, you've got an office manager somewhere who's doing this and saying, we got to move. You know, we got bills to pay.
Sure.
For lack of a better term. And so I understand that there's a lot of pressure there.
So your most valuable asset as a chiropractor are your ears, to be able to listen to people and get a chance.
Absolutely. Because as a chiropractor, you're not bound by an office manager looking at a clock and doing this. You know, you dictate how many patients do you want to see a day. If you only want to see 5, gosh, you got all day, you can sit and chat. But if you want to see more than that, you want to help more people, then you can maneuver it however you want.
So for instance, if I were to come in and see you, a big part of what we're going to do is determined by the questions you ask me and my responses. So you're really kind of getting my history and finding out as much about me.
That's right. And in the medical model is I want to help you out today, but then I don't want to see you back here again, right? I mean, that's the mindset of the physician is you want to help the patient so that they don't ever have to come back again, so that they're done.
That's a little counterintuitive.
A little bit. I mean, but that's kind of obviously they want to come back for annual exams or for vaccinations or something of that matter. But the intent is, let's do as much as we can today, and hopefully that'll suffice us and you'll be good to go. Whereas in chiropractic, it doesn't work that way. We work with people in ways that are along the same lines as you might think if you came in for weight management. Right. Well, I'm not going to give you a diet pill and then let you go. Right. That's something that you might have to come in regularly for in order to manage your weight, get it down to where you want, and maintain that.
Yeah. So you didn't get in trouble with weight overnight. You're not going to cure it overnight.
Right. Exactly.
And with chiropractic, my back issues that I have didn't happen overnight. I've worked at them for a while.
Yes.
And so it's a process, but when you have Dr. Stephen Shaw was my chiropractor in Las Vegas, and I think of him much more affectionately than any other physician I had. He just was a magic guy.
Right.
And going to see him, I always look forward, the days that I'd have an appointment with Dr. Shaw were kind of great days. And it is so interesting to have him go in and help me in other ways besides my back, knees and ankles, and you can tell my affection just when I brought up his name. And that, when you have that relationship with a patient, it's got to make you feel great.
Oh, absolutely, because it's a unique relationship. They trust you. These are patients who put all their trust in you. Oftentimes, we're the last resort. I've been to the dialogue is I've been to the orthopedic surgeon. I've been to this doctor. Here's what they want to do with me. Is there any other option? Is there anything else I can do? And so that's where we can really lean on our background and our experience and our training as to what are the options, what else can you do that might not necessarily be in that stuck medical model, where you manage it through a pain medication or some other type of steroid or something like that until it doesn't work anymore. Once it doesn't work anymore, then you go on to the folks who cut. And you have that dialogue, and they say, okay, you're a great candidate, let's... And
no surgeon has ever said that surgery might not be right for you. They get paid when they cut.
Well, sure. So it's important to find one who's seasoned and maybe doesn't have a lot of school debt to pay off, right? So,
is it a bad sign when you go into a surgeon and he's got a picture of his boat on the wall? Is that a bad sign?
Yeah, and all the luxury vacations, and yeah, I suppose...
If they have a jet run out of there.
Right. Very much so. I'm afraid so.
But when you get a chance to have a relationship with a patient, how quick have you seen results?
Well, sometimes it's instantaneous. I mean, oftentimes, if you've got let's say it's a lower back issue, right? And you are just out shoveling snow, and the quote-unquote back goes out, right? And they come in all hunched over, leaning to the side in obvious agony. It is not uncommon to be able to help that person within just a few minutes be upright. Maybe not 100% pain-free, although it can happen. But more often than not, they walk out feeling like they were attended to, they got service that they were hoping for, they're standing upright, feeling better, and they have recommendations of what to do from there.
And that's the most important thing in many respects, is to have those recommendations so you can avoid doing the things that got you in pain in the first place.
Right. And so that's where that is very important, to have that conversation with patients. And that's why it is, of course, after 20 years of practicing, I hear it all the time, and that is, well, once you go to a chiropractor, you got to go the rest of your life. Well, that's along those same lines as well. If you were 50 pounds overweight and you had to do something to lose that weight, whatever it was you were doing to get down to that weight, you better keep doing.
Sure.
Right? So it's actually a fallacy to say once you go, you got to go forever. Really, it depends on your lifestyle. Where do you want to be? What will you What will you tolerate? What pain levels? What activity levels? If you just want to be a couch on a couch potato, right? Just sitting on the couch watching TV all day and that's all you want to do, you probably don't need a chiropractor. Just lay around all day. But if you want to ski, hike, boat, get out there, you want to be with your significant other and go for walks or go for hikes, then you really better look at, how long can I do this for? How am I doing? And I can't think of a better person than a chiropractor actually to do that type of an evaluation and say, well, here's some blind spots you might think about, you might look at.
It would be funny to be able to talk people post-life and say, what are the things you do different? And I would imagine that most people, if they get a chance to look back in their lives, would want to be much more active.
Mm-hmm. Right.
And especially in Utah, because we are in arguably one of the greatest spots on the planet for recreation.
Sure, yes.
And to not get a chance to do things,
yeah,
I think would be a tremendous mistake.
Yeah, and we do see folks in that scenario where they do feel trapped. They've tried everything, and they are still struggling to just do the day-to-day tasks just to get through the day. And that's unfortunate because it can become very depressing. It can be,
and it's a trap.
Right, it can feel
the
like
less
they're
you
trapped.
move, the less you have the ability to move.
That's right. And if they can't move freely, they don't want to move. So if we can help them move freely, there comes the motivation behind it.
And when you see someone who has never been to a chiropractor before and get a chance to be on that ride where they go from someone who might be immobile to the point where they're all of a sudden getting around with less pain, and it kind of self-propagating where the more you move, the easier it is. It just keeps rolling that way.
Very much so.
No one's going to climb Everest if they've been a little bit of couch potato, but being able to go to a park with their grandkids and walking or having a dog,
right.
Those are the little victories in life that have to make you feel really well.
Oh, absolutely. And it really is good to find, to have a chiropractor on your team. We're not saying that you don't want to become a chiropractic patient and that's all you do and that's the only place you ever go. We are simply part of a team. You've got your physicians, you've got your all the different medical outlets, but it's nice to have someone on the outside of that can take a 30,000 foot view and look at you from a little different angle.
That's a good point, because you do get, if you go to a surgeon, he's going to want to cut. We've talked about that. But people, if you have kind of a training in a specific area of medicine, you're going to just focus on that. Whereas you're looking at, in your case, being up there at 30,000
Right.
feet and seeing how this physician works here, this nutritionist, boom, boom, boom.
Yes.
Kind of coordinating. You're the head coach, in other words.
And that's our training, is to have that type of a view of the patient as a whole. What's going on with this patient, not just their background, but who's on their team, whose opinions are they listening to. The joke in some of medicine today is, it's full of specialists. You've got your primary care physician, but if anything needs to be done, he or she is just not going to be the one to do it. They're going to be referring you to this guy or this gal or this person, some specialist. The problem with specialists is a specialist knows more and more about less and less until they know absolutely everything about nothing at all. I'm kidding.
And then they become a senator at that point.
No, that's the joke. But I mean, obviously we need specialists because they specialize in their particular niche. And we need that. But who's looking out from the top? I mean, who's really observing this patient in real time and what they're doing all day?
And you mentioned that you get to spend more quality time with a patient. So it's not a situation where you have 9 minutes, as in my doctor in Vegas.
Right. I mean, there are times when you need a half hour with a patient, and there are times where you just might need a few minutes. They just got a little something, not a big deal. You've got this rapport with them. You know their body. They know you. And it's a simple matter. It doesn't take a lot of time. And sometimes you need more time. Sometimes we need to schedule an hour to figure out what's really going on.
So at Utah Health Quest, tell me how you look at things maybe that will lead to some better outcomes for patients.
Sure.
What are some of the way you look at things?
Well, again, like we were talking about, as the chiropractor, we can really look over their care, what's going on. We have that time allotted so we can do that. What's nice about our office is we have multiple practices going on at the same time. Chiropractic is just one part of it. We do have the chiropractic wing of the office which is obviously geared towards that, as well as all the physical rehab. We have medics, rehab equipment, traction, decompression, all kinds of tools and things that we need for that type of trade. Under the same roof, we also have pain management, where we have a couple anesthesiologists that we work with who are very well schooled at that and know how to help people who we might need to co-manage between those two different disciplines. In addition to that, we have the interventional medicine group, which is more geared towards stem cell therapy, PRP, which is platelet-rich plasma, and the different cell therapies to just take it up another notch as far as healing and repair.
So that's the cutting edge aspect.
Yeah, it's a one-stop shop. At least that's what we're trying to create for people, depending on what kind of discipline they need.
Fantastic. So on a personal level, you've just moved here.
Yes,
And your whole family, you've got 5 kids.
I do.
And how are they loving Utah?
Oh, they're doing fantastic. You know, the older ones are in college now. We've got 3 in college, and so they're kind of flown the nest, as you might say. But the other 2 have integrated very quickly, nicely. They've got friends. They're situated, so we couldn't be happier. Yeah.
And from a lifestyle standpoint, there's no place better than Utah. And what we really have here is 4 seasons of fun.
Right, not 2.
Exactly.
So, and that was one of the things that drew us here, was we do appreciate those 4 seasons, you bet.
Well, thanks so much for taking the time. I appreciate it.
My pleasure.
Really enjoyed talking to you.
Thank you.
Utah Health Quest. Okay. Yeah. Doctor, thanks so much for taking the time
Thank
to
you.
talk to us. I really enjoyed it. Now, it is 11:28 now. I'll race you. Who's going to get up the mountain and go skiing this afternoon quicker?
Skis are in the back, so.
Mine are up there, so we'll have a race right now. You've been listening to Dr. Robert Bean from Utah Health Quest.